My name is Gary Grimard, and I've been involved in telecommunications infrastructure equipment my entire career. And we've created a product that we've called LifeLight, and it is a light therapy device that essentially brings sunlight indoors. Less than 150 years ago, we were more of an outdoor society. Just in those past 150 years have we evolved to become more of an indoor society, thanks to Mr. Edison's invention of the light bulb. As a result, we have lost the benefits that the sun gives us in energizing and boosting our day. Our mission is to bring that sun back to our daily life. We think that we can help improve wellness and health for literally hundreds of millions of people that actually work indoors every day by creating this light, allowing them to use it while they work. Science over the past 30 years have identified particular non-visual sensors in our eyes that respond to the color of a sunlit sky, that aqua or sky blue that you might, recognize when you're outdoors in the sun. That particular color causes a response in these non-visual sensors that manage hormone balances in our hypothalamus region of the brain. And that creates a daytime sensation when we're out, giving us energy, focus, cognitive improvements. One recent study in October of last year, of 2013, showed how the effects of caffeine and blue light are actually very similar in that they cause people to be alert. The difference is that caffeine causes people to have a little bit more of become prone to distraction. So in this clinical evaluation, where people would respond to particular cognitive skill tests and the like, when a distraction was put in place, those that were treated with blue light therapy were much more functional and productive than those that were treated with caffeine. Our Kickstarter goal is to raise a minimum of $150,000. That $150,000 will allow us to create the tooling necessary to produce the 5,000 units to fulfill the Kickstarter campaign. In addition, we'll be completing the development of our application that is used to control the LifeLight and to bring on the necessary staff to make this a globally available product. One particular client that I sat with, I had no idea that she was actually clinically diagnosed with seasonal affective disorder. And through one of our team members had been approached to evaluate our light. When I went in to deliver it to her, I had no idea that she was a seasonal affective disorder sufferer. And when I was presenting the demonstration, her eyes started to well up. And she thanked me for having brought a product that she saw she could use in her daily life, and was just thrilled at the opportunity to evaluate something that she felt could really benefit her. She's used it now for 3 weeks, and she's expressed so much joy at how much better she feels as a result of the LifeLight. That was something that really struck me emotionally, because I had no idea of the impact that seasonal affective disorder sufferers would have by a product that can benefit them every day of their life. There are lots of great products out there, and some of our competitors have been very successful at treating seasonal affective disorder, winter blues, etc. The thing that we've done different is we've purpose-built our product to be used every day for those of us that are tethered to a desk during our workday. Most of our competitors' products are large, bulky, disruptive type lamps that you'd have to dedicate time aside from your work in order to gain their benefits. What we've done is created something that looks very much like a desk lamp, allowed it to be controlled and managed by an application that the user can actually interact with and receive daily recommended levels of sunlight based on how they feel, and other outside inputs that no other product or provider has been able to afford to those clients. In other words, you can take weather inputs, you can take your personal schedule inputs, how late you were up the night before, how restful your sleep was with the current wearable technologies like a Fitbit or a Jawbone. We can read that into our algorithm and deliver to you every morning what kind of dosage or sunlight level we think you would need. And that's unique in the industry. So we're really personalizing the level of sun that any person would need in order to operate at their peak efficiency. The LifeLight is operated very simply. Plug it into the wall, position it out of your field of view, but yet into your eye. The application connects with this light through a Bluetooth connection. So from a smartphone or tablet, you can simply select the lamp, the color of light, and the intensity of light, and the duration, based on a recommendation that Sun LifeLight would provide every morning. The lamp is intended to be out of your field of view. Remember, the physiology is through a non-visual sensor in the eye. So you don't necessarily have to see the light in order to be affected by the light. Similar to when you're outdoors, you tend not to look at the sun or the sky near the sun, but yet you still get the benefits. Same thing with the LifeLight. You position it out of your field of view and in the direction of your eye, and the colors effect that physiological change that improves your energy. We've been asked many times, as a matter of fact, every time I talk with someone about the LifeLight, they ask if they could get a tan, if they get vitamin D. And unfortunately, in this product, we don't deliver ultraviolet rays, which are where vitamin D comes from when it reacts with the skin. Also, the ultraviolet rays are what turn your skin darker in the summertime. We do not deliver ultraviolet rays, fully safe. There's no concern. You don't need sunscreen when you use the product. Our competitors have targeted a particular market, that is, those that suffer from seasonal affective disorder and to a lesser extent winter blues. In the United States alone, that's about 60 million people. What we've done is create a product that everybody benefits from. And that's the beautiful thing that's happened in state-of-the-art science over the last 5 years or so. Everybody benefits from getting the particular light that we deliver in boosting their energy, focus, well-being, and health, even if they're indoors most of the time. That's different than what our competitors do. And we want people to understand it's not just if you're clinically diagnosed with a depressive disorder that you'll benefit from bringing the sun indoors. Everybody does.